Okay, part 2 on cholesterol. Again, follow me on Facebook on Longevity, Strength, and Health. My name is Dr.Anglen, and the things I've earned degrees in are my undergraduate 4-year degree is in nutrition. I have a doctorate of chiropractic. I went to medical school and I graduated as a medical doctor. Certified to do acupuncture since like 1992. Try to use natural ways to heal the body. Definitely see the benefit of medicine. Last time we went over this, some readings from this book I wrote a while ago, long time ago, on how to determine what your optimal levels of cholesterol are on a blood test, according to experts in the fields of functional medicine and natural health. What cholesterol is and how it helps the body, medical conditions that can raise or lower your cholesterol and that should be addressed to help somebody be completely well and to help their cholesterol heal or be better, you know what I mean. So this book talks about all the different, not all the different, but it talks about a lot of the standard blood tests, what they mean, why they're up, why they're down, and things you can do about it. If your cholesterol's too low, there's a product from Standard Process called Antranex, as well as taking methionine, choline, and inositol. If cholesterol's too high, number one thing I recommend is polycosanol. I mentioned that already, and that it has to come from sugar cane to be effective, according to the research I've read. Other things, niacin, lipase enzymes, things like that. So I'm going to mention a couple of those. Diet and exercise seems to be about the most effective for high cholesterol. Niacin, vitamin B3, is very effective for lowering cholesterol. In 1975, the Coronary Drug Project was published in the Journal of the American Medical Association and showed that niacin was the only thing that really lowered the death rate back then in the 1970s when compared to the medical drugs that were available. Niacin is vitamin B3. It reduced the risk of heart attack by 29%. It reduced triglycerides by 52%, and plasma cholesterol fell by 22%. But more importantly, people didn't die as much. And some of the drugs they compared it to, people died a lot more. Some of the drugs they compared it to increased the death rate 36%, even though it lowered cholesterol. So it's like, okay, the cholesterol's lower, but I'm dying. That sucks. I don't want to die. So they compared niacin to the drug lovastatin. Lovastatin is from a class of drugs known as statins. Statins might be the most prescribed drug for elevated cholesterol. It was found that niacin was more effective in a study by Illingworth called Comparative Effects of Lovastatin and Niacin in Primary Hypercholesterolemia, published in the Archives of Internal Medicine in 1994. But niacin, if I remember right, looking at the research, is the only vitamin that has caused a death. And it was a death with one person who was schizophrenic, and niacin can cause the skin to flush red and tingle. And the schizophrenic person was taking lots and lots of niacin to get that effect because they just liked it. And it caused liver failure. If you have pre-existing liver disease, you probably don't want to take niacin. You don't want to take elevated doses. In this, I try to give recommended doses levels for the therapeutic duration of nutritional therapy. Once somebody's gotten through the therapeutic level and their chemistry is normal, then they can go to a maintenance level, which is very low. The most toxic form to the liver was sustained release niacin, and that was published in the Journal of the American Medical Association in 1994 on a comparison of the efficacy and toxic effects of sustained versus immediate release niacin in hypercholesterolemic patients. That was the name of the study. The safest form appeared to be inositol hexaniacinate. So niacin. But again, it's not the main thing I'd recommend. Polycosanol is the number one thing that I'd recommend trying first and only stacking additional things on it if that wasn't working in isolation. When you have high cholesterol, the arteries clog up like a clogged toilet. So what you want to do is open them up and get some blood flowing through there. High doses of vitamin C can do that. Dr. Joseph Vida at Boston University Medical Center found that 2 hours after taking a 2-gram dose of vitamin C, the arteries dilated 10%. From what I remember, that's because the tunica muscularis expanded. So once the vitamin C had cleared the body, it probably closed back up again, but they did get improved blood flow. 2 grams is a lot of vitamin C. Take it with caution. It can upset the stomach. It can cause diarrhea. The form that I recommend anybody take is an ascorbate form, where it's linked to calcium and magnesium. You're also getting those, but it helps buffer because vitamin C is ascorbic acid. It's very acidic, and you don't want to make your body more acidic. You want to usually try to make it more basic. There's people who know a lot about nutrition academically. They might have a degree in biochemistry or something, but they haven't actually worked with many patients. I've been a medical doctor. I'm not a medical doctor now. I've been a chiropractor. I'm back to doing chiropractic. I've been an acupuncturist for a long time. I do a little acupuncture still, but I've worked with patients. I've read hundreds of, maybe thousands of blood tests, worked with in the trenches. I'm a combat soldier of healthcare. And in all those years, I've checked a lot of people's, probably hundreds of people's pH, whether their body's acidic or basic, and only ever seen one person whose urine was basic, and that was a Buddhist nun who ate a really vegetarian diet and meditated like 2 hours a day. Exercise produces lactic acid. We produce a lot of acid. Meat, dairy, and sugar make your body very acidic. Sugar's so acidic it'll burn holes in your teeth. Dentists say, don't eat sugar, it'll burn holes in your teeth. And you know what? It burns holes in your teeth. And so we want to try to keep our acids down. Vitamin C is ascorbic acid. It's more acid. I like the ascorbate form because it is buffered because of those minerals. That optimal level, the famous Framingham study set the cholesterol level optimally to be 150 as a baseline. They found that each 50-point increase caused a dramatic increase in the risk of death. People whose blood cholesterol was 200 had a death rate 100% greater than people whose cholesterol was 150. People whose cholesterol was 250 had a 300% greater risk. People whose cholesterol was 300 had a 600% greater risk of death. And so 150 to 180 is where we want to be. There's other factors, and so don't get too OCD, obsessive compulsive, about keeping it right there. Things fluctuate, and there's other things that are also important. So in a nutshell, cholesterol's good. It builds hormones. It helps make our cells strong. We don't want it to go too low. 150 to 180 would be optimal, ideal. We all struggle with something. There's a need for medicine. Certain medical conditions like hyperthyroidism, hypothyroidism, diabetes, can aggravate cholesterol imbalances, and so medical care can really help with these other things too. Dietary, try to eat primarily a plant-based diet. I drink coffee with sugar and stuff. I'm not supposed to for a number of reasons, but I love it. And I exercise daily. I try to drink lots of water. Polycosanol is the number one thing I recommended for elevated cholesterol. Secondarily would be like niacin. If someone really is having clogged arteries, vitamin C can open them 10% quickly. If someone's cholesterol is too low, that can be a bad thing too and increase the risk of hemorrhagic stroke. And I recommend Antranex from Standard Process, along with choline. I want to read this to make sure I don't get it because I sometimes don't speak so good. Methionine, choline, and inositol to help increase the production because cholesterol is produced in the liver. I'm always here for consultation. I'm starting to bring a call to action. Normally, what I like to do is evaluate a patient's health, what drugs they're on, if any, what their diet's like, what a diet diary looks like, what their exercise is like, and get their basic blood tests so that I can tailor the nutrition to their biochemistry at that time, try to improve their life and their health to help them live longer, be stronger, be healthier. And as they improve, reevaluate those things, look at other blood tests, and help make modifications to get them into their optimal range so they can live long, strong, and healthy. Normally, it's like $300 for me to do that for the initial consultation, evaluation, and recommendation for a short period of time. Today is April of 2016. For a short period of time, I'll be doing that for a limited number of patients for about $100. Doing the whole initial evaluation, review of blood tests. That doesn't count getting the blood tests done. If you don't have those blood tests done recently, I can probably get those done for you. Order them somewhere depending on what state you're in, and if not, find someone who'd do that. And let's get you healthy and strong. I hope this has been helpful. I'll try to review more things. Today it's on cholesterol.